You arrive on scene and you see a person lying on the ground. Everyone is staring. The clock is ticking. Do you know what to do next? Hi, I'm Robert, the first aid security guy. And in this video, I'm going to walk you through the priority action approach using the general emergency principles: scene safety, response, call for help, and the ABCs. Step 1. Assess the scene for danger. First aid starts before anyone touches the patient. The responder stops, looks, and assesses for danger to themselves, the patient, and bystanders. Look for hazards like traffic, electricity, fire, chemicals, unstable footing, violence, or anything that can create a second victim. If the scene is not safe, do not enter. Make it safe if possible, or wait for emergency services. Step 2. Check for a response. Once the scene is safe, the responder approaches and checks if the person is responsive. Speak clearly and use a firm but safe shoulder tap. Introduce yourself and ask, "Hi, I'm Robert, the first aid attendant. Can you hear me? Are you okay?" Watch for any response: movement, speech, eye-opening, or purposeful actions. Step 3. Call for help. If the person is unresponsive, seriously injured, or the situation feels beyond basic care, help is called immediately. If others are present, the responder points to one person and gives clear directions. You call 911. Tell them we have an unresponsive person. Come back and tell me what they say. If alone, the responder calls 911 as soon as possible and follows dispatcher instructions. Step 4. Airway. First check of the ABC process is A for the airway. After help is on the way, the responder checks the airway. Look for anything blocking it, like vomit, blood, or a foreign object. Open the airway using the appropriate method based on training. If a spinal injury is suspected, the responder uses the safest approach they are trained to use. Step 5. Breathing. Next is breathing for the B of the ABC process. The check is quick. Look for chest rise, listen for breath sounds, and feel for airflow. This assessment should take no more than about 10 seconds. If the person is not breathing normally, the responder begins life-saving steps based on training and follows 911 guidance. Step 6. Circulation. Next is circulation for C of the ABC process. The responder checks for severe life-threatening bleeding and controls it immediately with direct pressure. If bleeding is massive, bleeding control becomes urgent. If there are no signs of circulation and the responder is trained, CPR begins and an AED is used as soon as it is available. Provide care and reassess. Once the ABCs are addressed, the responder provides care within their level of training. That might include continued bleeding control, CPR, treating for shock, keeping the person warm, and constantly reassessing. The responder watches for changes and stays focused on the basics until advanced help arrives. Handover and documentation. When emergency services arrive, the responder gives a clear handover: what happened, what was found, and what care was provided. As soon as practical, actions and observations are documented, including timelines and changes in condition. Documentation matters for continuity of care and workplace reporting. First aid is about doing the most important steps first: scene safety, response, call for help. Then the ABC: airway, breathing, circulation. Stay calm, follow procedure, and do not go beyond training. Remember, first aid is a life skill that matters. Thanks for watching and have a safe day.